think that giving people time back in their day so that they can engage meaningfully at work and have relationships at work is absolutely critical. It speaks to their well-being, right? We make friends with and become close with people at work. It's just a thing.
I mean, last time I checked, we are in the people business.
That's right. That's right.
So it's like giving people the space to actually engage with people is huge.
We got that down from 24% of our authorized days were being unused, down to 2.5%. Which was amazing in terms of the transformation. That was via a combination of efforts and a confluence of various different impacts by launching the AI assistant in Sunwave.
Welcome back to MasterMined. I'm your host, Mark Scrivener, and as always, joined by my co-host, Jeff Skillen. Jeff, welcome to the show, man.
Mark, it is great to be here as always.
Yeah, great to have you on the show. And today's show is going to be a special one. We're joined by a leader at the forefront of AI conversations, Brian Wind with JourneyPure. He's the Chief Clinical Officer at JourneyPure. We're excited to have you on the show. We saw you on a panel discussion at NATAP National 2026, and you were our very first guest when we filmed down at NATAP for the MasterMined, and we were trying to learn a few things there from a sound quality standpoint, and so we appreciate you taking a second take at this and coming up to our studio in Nashville. Brian, welcome to the show. It's great to have you on.
My pleasure. Thanks for having me in. It's an honor to be here with you, gentlemen.
You know, it was kind of like, we were a band that put together a studio album, and it's like we got it all dialed in, and then we're going to go do our first live show, and then it's like we, mic check and sound check, and, there's some variables. So it's like it's great to have, Brian back in the controlled environment.
Yeah, it was actually all going great until there was one lady, and not sure who she was, but she walked by talking at probably 10 decibels, having a conversation on her phone. And so that just was not going to work, even though we thought we had it all figured out.
Yeah, I hope she got that admission in.
It's not a worry. We really had a dress rehearsal. For
yeah,
this,
exactly.
Which is great. Yeah, I don't often get that.
Well, so we don't need to stay on NATAB, but I will say that when we sat down, Brian, the conversation really flowed, and it was I learned a lot. I mean, we've known each other for a while, but I learned a lot about how much of a pioneer you are in the space and how you're utilizing AI. So I want to talk about your clinical brain, and then I want to talk about your business brain and all of the ways that you're using AI. So where would you like to start? Do you want to talk about what are you doing clinically with AI? Or?
Sure. Well, I'll just talk about who I am and where I'm from, if that works for you. So I'm a psychologist by training. I got into this business over 2 decades ago. I don't mind sharing with you, most importantly, that I'm a person in recovery myself. March 7th, 2003 is my sobriety date.
Congratulations.
And I say that, I appreciate that, and I say that never to try to impress anybody with length of time in recovery, but more to convey, hopefully, that this is more of a heart mission for me, a personal mission, rather than some mercenary business type mission. I absolutely love what I get to do, and it's still very much a get-to-do type prospect for me, with all the ups and downs of being in this wonderful business of serving people in need. I absolutely love it. I'm not sure exactly how I evolved into the AI space, but I did make a conscious decision at one point a few years ago that I wanted to kind of branch off into some postgraduate areas, if you will, kind of breathe new life into the content that I'm really focusing on. AI was one of those areas. Gambling disorder was the other area, and I've really developed an interest in that as well because it became the case a few years ago that you couldn't listen to a news media outlet without hearing about AI, right?
Right.
Suddenly, I was kind of fast-tracked in that direction, and we launched it in our system of care at JourneyPure, pretty big system of care at the time, and really that just kind of sent me into the stratosphere of learning more about AI. I became curious, really, I think is the summary of it.
So born out of curiosity, necessity, or both?
Both.
Okay.
Absolutely both. When we started this journey, it was mid-2024, if you can remember way back to 2024, right?
back in the day, right?
In the AI world, that's eons ago, right? That's like, 2 decades ago in the AI curve, if you use that as a time perspective on this. But I was noticing that the news media outlets were frequently mentioning AI. It was just everywhere, suddenly, it seemed. At the same time, our company was experiencing a bit of a downturn in our key performance indicators, our KPIs, the ones that we paid attention to, like our average length of stay, our number of authorized days we were getting from insurance companies, our against medical advice departure rates, which you wouldn't think would be related to this, but certainly an important key performance indicator for us. Successful completion rates, all of these metrics that I think a lot of people in our space pay close attention to. And I noticed that there was kind of a sense of operational friction with all of that. So for me, I got curious enough hearing about AI that I started to wonder how could it fit into our workflow and create operational efficiencies that might then in turn impact our key performance indicators in a positive way. So I presented it to our leadership team, stuck my neck out there a bit. We had a platform we were using at the time. We've been engaged with Sunwave for several years now. Sunwave, just by dumb luck, has an ecosystem of tools, right? They have a client relation manager, CRM, electronic medical record system, EMR, lots of acronyms here, revenue cycle management, RCM. Billing tool, right?
Yep.
An alumni tool. And I thought, all right, step number one, why don't we take advantage of this system that has an ecosystem of tools, multiple layers of tools, rather than having data warehoused and siloed in several different platforms that becomes cumbersome, burdensome, expensive, and creates that operational friction. So that was step number one. And then I thought, well, they have an AI assistant now coming out. What if we put that AI assistant in the passenger seat next to our teammates? How might that impact their workflow? So it was a bit of a risk because this isn't free, right? It costs money to purchase the AI licenses for all of our users. And we launched into this, and I was so curious that I did a year-long clinical research study on this, through which I examined user satisfaction survey data. And then I looked at our clinical and operational KPIs to see what the outcome would be. So it was really a process for us that was, I like to think it was well thought out and planful in the way that we executed on it.
You know, Brian, I think in any organization, it all has to come from the top. And it's interesting that it's coming from the chief clinical officer, because a lot of times it might come from a CEO, COO, but you're very uniquely suited to do this. I guess as you started to implement some of these things, did you build a team around you that had some AI influence within JourneyPure?
A small team
Okay.
of a trusted core group. We have a Sunwave guru, as we call her, named Carla Parker. Carla's been with the company. The only person with JourneyPure that's been there a little longer than I have. I've been there almost 11 years. And Carla is just a whiz. She gets this stuff. She mastered the Sunwave platform inside and out. So she was a partner in all of this, along with our quality and compliance director, Jonathan Billingham, and some other teammates that were really kind of in that core group as we pushed forward. Really, Mark, the thing that I think this demonstrated on the front end, if nothing else, if there were no other benefits to it, I think a great leadership principle is to give your teammates the best tools you can in order to do their job, and then get out of their way, take a step back, right?
Yeah.
If nothing else, this demonstrated that leadership principle, to give them what we perceived to be the best tools out there to do their job, and then let them do their job, right? And so it demonstrated that principle, I think, first and foremost.
Yeah.
You know, looking at that sort of 1-year clinical trial, which I think is, I think it's important because a lot of people probably make decisions sooner than that. A lot of people are looking for a shorter time frame. Like, let's try this for 30 days and see what happens. Let's try this for 90 days and see what happens. But the fact that you had sort of a year to take a look at it, I'm curious. So what was one thing that turned out exactly the way you thought it would, and what was something that was surprising to you?
Yeah, the user satisfaction survey data. So I administered this at launch when we implemented the AI assistant in Sunwave. I then did it again at 3 months because I was so curious to look at the data that I looked at 1 quarter pre-launch and 1 quarter post-launch, because I really wanted to see if this was going to gain traction. I then expanded it out to 1 year when we hit the 1 year mark to eliminate any confounding variables related to the seasonality of our business that
Right.
we all say exists, right? Maybe
Right.
it does, maybe it doesn't, right? But in some way or
That's a whole
fashion
other
it does.
podcast.
Right, exactly. It sure is, absolutely. So at launch, one of the biggest concerns with our users was about accuracy. In fact, about 2/3 of our users said this thing is not going to be accurate. I questioned that on the front end. 94% of them on the back end at 1 year mark and the similar numbers at the 3-month mark noted that it was very accurate, like that was one of the highest ratings. So it debunked the accuracy myth, whether it's algorithmic bias or other things that they were concerned about related to this. That was kind of a surprise to me, the huge shift. The biggest concern was accuracy, and then the biggest benefit noted on the back end was accuracy. So it just kind of debunked that. The other thing that surprised me was the impact on our against medical advice departure rates. Now, you might say, what does AI have to do with AMA rates? Here's what I've learned anecdotally, and there's pretty firm evidence behind this. Our clinicians suddenly were not locked in their office with a do not disturb sign on their door, frantically trying to document and build notes manually from the ground up so that they didn't have to do this at 10 o'clock at night after they put their kids to bed, right? I mean, that's what our industry had become. Burnout rates were on the rise. Retention rates were awful for us. We got to the point where our average retention rate for clinicians was like 8 months. It's terrible, right? It was just a heavy load that they were carrying, documentation burdens and other administrative burdens. Now they were getting their documentation done in such a timely fashion that they had more time. Now, I can't measure what they're doing with that time. Maybe they're at the water cooler chit-chatting. Maybe they're in their office with their door shut, scrolling through Facebook. Whatever it is they're doing, frankly, I'm not real worried about that. It gave them a bit of their time back. And now what I was hearing anecdotally was they were putting to use the AMA blocking protocol that I wrote. I went to the trouble of writing this nice handbook with all these different motivational interviewing tools in it, reasons for departing AMA and how to kind of combat that and redirect people and get them re-engaged. But the protocol wasn't being used because people were overburdened with administrative tasks like documentation. So suddenly now I was hearing the clinicians are out of their offices engaging in AMA blocking protocols, and lo and behold, over the course of a year, our AMA rate decreased 9%. It doesn't sound like a huge percentage, but it's a massive percentage for us. We had gotten up to an AMA rate of 27%, which is abysmal in my opinion, for better than 1 out of every 4 people you admit somebody's kind of sneaking out the back door, if you will. And that is not tenable for a company. So we got that AMA rate down closer to our target in a big way. The short story, without going into the mathematics associated with it, I did some rough calculations on an annualized basis. That changed our numbers by about $14.52 million.
Wow.
Now, can I attribute all of that to our launch of the AI assistant and Sunwave? No, not necessarily, but some percentage of that is due to that, right? I mean, our AMA rates going down was not by coincidence. It was at least correlated with that.
Yeah, that's fabulous. On the AMA rates dropping to that level, I'd be interested in hearing maybe some of the other key findings that you did, like how it really impacted JourneyPure's business.
Absolutely.
Because, I mean, certainly when people are listening to this podcast and they hear a number like that, their ears are going to perk up.
Yeah.
Sure.
For sure.
Yeah. And you know, I'm open about saying this. I had exactly 0 business classes in psychology school. So it was kind of OJT, on-the-job training for me to learn, you know, how to read a spreadsheet and what KPIs were and all of those kind of things, why they're important. I'm one of those people that believes, like a lot of folks out there, if you're not measuring the numbers in your business, it's going to die on the vine, right? So we had been doing a great job of gathering data. Of course, again, it had been siloed in different platforms and places, so the synthesis of that data was a bit difficult. When AI came around and we launched it, I noticed that data synthesis was amazing, the way it could pull together data from the CRM and warm handoff to the EMR, which then had a nice warm handoff to revenue cycle management. Claims were dropped seamlessly. We didn't have any more of these reports going out on a weekly basis that we had created created. It was called the No CPT Code Report. What an awful name, right? It's just like this doom and gloom name, like, hey, we've got claims in purgatory because of you. Fix these that you can and get it back to us by Monday. That was the mandate, right? Suddenly, all of that was off the table. Things were just more seamless. But the clinical and operational KPI evaluation was something that was important to me. I didn't just want subjective data from a user satisfaction survey, both at time of launch and post. That was important information, but I wanted to look at the real objective type numbers, not just subjective data, but objective numbers. We saw increase in authorized days of over 3 in the course of a year. We had an average length of stay increase of 2.9 days. The big one was our unused authorized days. What does that mean? Insurance company gifts us days in treatment, right? Which is the way they see it. Sorry, insurance companies, but they do, right? We're giving you the gift of residential days in treatment. And then we were leaving days on the table, whether it's out of AMAs, that's the big culprit, right? Somebody gets authorized for 14 days in residential, they leave at day 4. You've left 10 days on the table. So that was one of the big culprits. But the other one is permissiveness, because we're all codependent caretakers. When somebody says, I know I'm not due to discharge till next Friday and it's only Saturday, but this is the only day I can get a ride home, and my aunt has a wedding tonight, and I think I'm out of here, And we would find that clinicians would say, well, seems reasonable. You've done pretty good work and made reasonable progress toward your treatment goals. Knowing full well that finishing what you started based on clinical research data dramatically increases their chances for long-term success in recovery, right? So we got that down from 24% of our authorized days were being unused, down to 2.5%. Which was amazing in terms of the transformation. That was via a combination of efforts and a confluence of various different impacts by launching the AI assistant in Sunwave.
So was that about making it more visible to the team so that they could actually see what was happening? So it's first identify it, make it visible, and then make changes to then work towards that number. Is that the idea?
Absolutely. And here's the thing, because Sunwave has what's called realms, we have these monthly quality assurance meetings that we call realm meetings. So in each different realm of all the different
Sounds very
markets.
Game of Thrones.
Yeah, doesn't it? Yeah, a little GOT in there. Yeah. So we have our realms of Sunwave that match up with our markets roughly. And we would have these monthly realm QA meetings, and suddenly, using the EOS leadership model I use, we begin with the segue, which is where we share good news and celebrate wins, right? All these meetings were opening up with major wins that heretofore we had not seen at all, right? It had been a really negative valence in a lot of these meetings, like, geez, length of stay is down. What's going on with your AMAs? Good grief, you guys are at 30% so far this month.
Just harping on the negativity.
Yes. Nothing to celebrate, really. Suddenly, we would spend 5 to 7 minutes at the beginning of the meeting where people are calling out wins to celebrate, both personal and professional. I'm not documenting at 10 o'clock at night anymore. I'm better able to engage in self-care like you told me to, Brian Wind, talking out of both sides of your mouth, right? Telling me to take care of myself, prioritize my self-care, but then can I get all my notes done before the end of my shift and make sure I can work a double over the weekend because we've got people out of work and so on and so forth, right? I'll be the first to admit I've talked out of both sides of my mouth when it comes to prioritizing self-care in this business. So now people were in a better place. It was a palpable impact on the morale. We're celebrating things in these realm meetings now because the numbers look better. And suddenly our retention rates went up, burnout went down, and signs and symptoms of that were suddenly nowhere to be found in our facilities. It just felt good to have taken a tool and employed it, put it to great use such that it benefited our teammates who are doing this valiant work of caring for others day to day.
Well, you just name-checked EOS. So we have mentioned EOS on this podcast before, but we've mentioned it sort of hypothetically, Mark. You and I have talked about it. I think we've talked with Lee about it. Maybe tell our listeners what EOS is and speak to it just briefly about how that's really impacted, performance at the company.
Oh man, it has impacted our company's functioning in so many different ways. I became a fan several years ago.
So it's
Gino
the
Wickman's book,
Entrepreneur Operating System.
That's right.
EOS.
Yep, the book Traction by Gino Wickman is really what outlines it the best. Here's the way I look at it. Every person in a company, every department for sure, and perhaps every person in a company has a number, right? At least one number that's important to them that they might need to hit as a target. Maybe not to them personally, but to management and leadership for sure, right? So different departments, how they're functioning, even down on an individual level. And really all of those numbers together comprise what I call our company's scorecard. And that scorecard is really comprised then in turn of all of these key performance indicators that we were talking about. And there are various different departments and individuals that are responsible for trying to move the needle on those numbers that are kind of assigned to their department on our company scorecard. So really, after the segue of sharing good news in the leadership agenda, this is the weekly leadership meeting agenda, the next thing we do is review the scorecard. All right, we've celebrated the positives. Great way to start a meeting, right? Everybody's off on a great foot and cheering for themselves, et cetera.
Right.
Now let's look at things that we might need to look just as importantly, maybe more importantly at, related to deficiencies or subpar performance on our company scorecard, and then engage in what's called the IDS process, identify, discuss, and solve. And that's where the meat of the meeting is spent in that IDS process, from which then we develop a concrete list of to-dos, action items, assigned to a person, and they have 2 meeting cycles to complete those to-dos. If they can't, for some reason, someone else gets called in to help with completion, or it gets assigned elsewhere, or we reevaluate it and see if there's a different angle we can take. And with that, there is an issues list that's kept corresponding to that, and the issues then have solvable action items attached to each of them on this list. And then we spread that through the company widely. It's broadly communicated. We've got intermediate term projects that are called ROCs by way of the EOS model. We've got our goals and targets, strategic pillars, and our mission, vision, and values all in what's called the Vision Traction Organizer, the VTO, which is kind of a templated 2-page form that gives a snapshot of your organization. That's just so helpful to keep everybody moving in the same direction. So I can't say enough about the model and what it's done for us. It's been beautiful to demonstrate the impact of AI in our system of care.
That's where I was going to go, is that you were utilizing the EOS system at JourneyPure long before you started doing
Correct.
these AI integrations, right?
Yeah.
So it's remarkable how much that influenced what was already sort of an effective management model.
It was the influencer, because that operational friction that I mentioned at the outset of our time together today was evident in our company scorecard. And it was just not what I had envisioned for our company. I mean, everything was just kind of taking a turn for the worst. And I thought, what is happening right now? And boy, launching that tool within 3 months, I mean, the major impact on that company scorecard was just, it was palpable.
Yeah, Brian, we use EOS as well. Sounds like you could be an EOS coach, implementer, with your knowledge of it. But just I can only imagine the momentum that became more momentum when you go in and you're having those segue sessions and all that positivity's coming out, and it creates so much more momentum for the AI. Yeah. And I guess, just one question I might have is, for operators across the country that are starting to implement, I mean, the first key thing as you're trying to structure all your data is making sure that they have clean, structured data in the back end of all their systems. I guess, what kind of process did you go through, or was it all pretty pristine when you started with the AI tools, or did you have to do anything to go in to make sure everything was clean and structured?
Yeah, I'll tell you this, and it doesn't serve me because it makes me sound like I really did nothing, but honestly, it was one of the easiest implementations of any major tool ever. When Sunwave first pushed this AI assistant out, it had a little icon. It used to be called Mara AI, and the icon was Mara's head. And when you were in a form in Sunwave that had a free typing box where Mara was eligible to help you out and be your assistant, all you did was click the icon and watch the magic happen. And literally about a second and a half later, your note was written beautifully, by the way. And if you didn't like it, click it again. And you can do that as much as you want. And of course, one of the challenges was trying to make sure human oversight and clinical voice was preserved in this. And I encouraged people strongly to review your notes. Don't just click it and forget it and sign off on it, because AI can make mistakes. That wasn't really a big issue for us. The accuracy of this was through the roof, in my opinion. But nonetheless, we still want people to have clinical voice and oversight and all of this so that the AI assistant remains in the passenger seat, right? Not jumping into the driver's seat and our clinicians or our medical providers are in the back seat suddenly feeling like AI is driving this vehicle. So getting that in place, ethical use of AI, boundaries around it. I think it's a bit of the Wild West in certain areas when it comes to AI. And, we were pretty cautious with our approach. The tool that we adopted was an entry-level tool that helped with composition. Good data in, good data out kind of process, right? So you're checking click boxes and things like that through the biopsychosocial assessment, for example, and then it writes a beautiful clinical narrative summary at the end. By the way, on the biopsychosocial assessment alone, we found at the 1-year mark that it saved our clinicians 44 minutes per one administration of a biopsychosocial assessment. Now multiply that times several per week on average for our clinicians. Suddenly, 44 minutes times 6 or 8 biopsychosocial assessments in a week, that's a full work day, 6-8 hours of time saved just from biopsychosocial assessment administration's assistance with the AI tool. Mind-blowing, right? No wonder they had more time. That doesn't even count their group notes, individual session notes. Continuing care planning was another big area that was highlighted as AI having a major impact on our medical providers and clinicians' quality ratings with our QA team. They're trained in inter-rater reliability and rank the same way in terms of how they score quality in our QA measures. The clinicians' QA ratings went up 46%, and the medical providers went up 39% in terms of their overall Likert scale ratings. Amazing. So efficiency and quality are not opposites. And here that was a myth that I had to debunk for myself, right? I always thought if you want to do great quality work, it's going to take rolling up your sleeves and extra time, and you're going to have to put in those extra hours. And suddenly we debunked that, and efficiency and quality were not, in fact, opposites.
So reclaiming clinician time is a huge theme that I'm picking up on, which I think everybody that's listening to this is like, yep, that makes perfect sense, and I'm glad the tool is working, right? Mm-hmm. In terms of the Wild West, it's like, so where do you start getting a little more hesitant in terms of like next moves?
Yeah, so Sunwave happens to have an ambient listening tool coming out soon. They've got kind of a 2.0 version coming out soon that I think is going to be next level. I'm
so you're thinking like group notes
about that. Yeah, and the treatment planning tool is going to be off the charts. We're now going to get to a place that I'm excited about future facing, where the AI assistant can help with development of the treatment plan, of course, first and foremost, based on data that's been put in, dating all the way back to the initial phone call, right, from the CRM, because remember, it's in an ecosystem of tools, including data from the biopsychosocial assessment and all of the visits up to that point where the master treatment plan is being developed. And then when treatment plan reviews or concurrent reviews or ASAM version 4 forms, assessment forms are being administered, suddenly the AI assistant can make recommendations for the treatment planning. Here's a tool that we might pull out of the clinical toolkit that would be useful given this person's history, background, and diagnostic formulation, right? So that next level tool is super exciting to me, along with the ambient listening. Here's the thing that has blown my mind. 2024 wasn't that long ago, right? And we launched this in Q4. Yeah. Like I said, in the AI world, it was eons ago, but the Q4 of 2024 is when we launched this. Everyone was cautious, including me. I wanted to dip my toe in the AI pool and just kind of see what this was all about, right, before I trusted it. Now, caution is really at the 1 year mark post-launch. Caution is really deprioritized, and the rallying cry is give us more. Give us more. We want the ambient listening tool. We want scribing going on. We want to click start session in an individual session and then click end session and watch the magic happen on it, writing a note for us, of course, then reviewing it and editing it as needed. So it's amazing. No more concerns about accuracy or algorithmic bias or security and compliance. Those were big concerns that were non-negotiables on my end, on the front of all of this. Suddenly it's like, we don't really care if it's a third-party plugin tool. We don't care if it's native to the platform. We're not really sure where the data goes, and we're not too concerned about that. We just want more. We want more assistance because now we've gotten a taste of what life can be like with improved quality and increased efficiency kind of in the same equation. And it feels good, I think, to the people that are working in this industry. They can breathe a bit finally.
Yeah, I can only imagine the level of care that you're able to provide now with your clinicians, just giving them that time back. It's amazing. One question I would have is, like, you're not just all centralized in one location. You've got multi-locations, lots of people in the organization. How did you guys scale this out? How did you train everybody that wasn't in that central hub of your weekly L10 meetings? How'd you get it out to the organization and scale it?
Yeah, it was fairly seamless. We started, full disclosure, with a brief pilot. It lasted about 10 days. We had a couple of clinicians in what was then our Ohio facility piloting this AI.
Did you bring them to Nashville, or did you just?
We did not. We did all of our work remotely with them and started getting feedback. The writing was on the wall almost immediately. I had already demoed it with Sunwave. I had done great collaborative work with them. Their team is incredible. I've just become closer and closer with them over time, which is refreshing when it comes to third-party vendors in our space, right? There wasn't a distancing of the relationship. It became a closer, more collaborative relationship, and I've loved that about that relationship with Sunwave. I realized that real results and appreciation of those real results takes real adoption. So at about the 10-day mark, I was like, I don't know why we're doing this as a little side hustle project just to see how it goes with a couple of people, and that could turn into something that's just in perpetuity. A couple people have access to this. Let's just jump into this AI pool with both feet, of course, with appropriate caution in place.
So let me just ask you, because I'm curious, as people are listening to this, is like, Brian, are you in general kind of a risk taker in that way, or was it just so obvious that it was the right move?
It was. I'm a moderate risk in this business. I'm comfortable with a mid-grade, moderate level of risk.
Because I know that there's some people out there in the clinical seat that are very cautious in that regard.
Absolutely, and that's one of the things that we were up against. I think. Remember, the biggest concern going into this was accuracy. Two-thirds of them, this thing's not going to be accurate, or it's going to be biased, or it's going to take my job. We're going to cut down staffing. Right. That's always a concern, right? And I like to think that we really kind of did a 180 on all of those myths, as it turns out. We preserved clinical voice and human oversight. We showed people that we're not looking to decrease staffing patterns per se. We're trying to get you to make better use of your time by giving you the best tools we can to do your job. So scaling it and getting it out into all of our different states, which at the time were 9 states, was actually fairly seamless. It was just that the licenses were granted, and suddenly the icon for the AI assistant appeared in the forms for which it was available, and the instruction when we did an all-staff meeting and a demo to show them how to use it. It was one of the shortest all-staff training meetings that we've ever done.
They're
honestly.
Like, got it.
Yeah, got it. Yeah, click the icon and watch it happen. And if you don't like it, click it again. And of course, review and edit it. And we couldn't stress that enough. I'd still throw that out there today. I used to, in an ugly way, call it the laziness factor, but now I just call it the human component, right?
Yeah.
It's us as human beings, the hedonistic minimum amount of effort and maximum gain from something, and that was something that we noticed, we needed to keep reinforcing with people.
I mean, there may be somebody out there that wakes up every morning and says, give me more documentation chores, give me more charting chores. I mean, maybe, I haven't met them, but maybe they're out there.
Yeah, maybe so. I'm of the school of thought that this gives people time back in their day for whatever. Maybe it's so that I can engage more meaningfully with you, Jeff, as a patient in one of our facilities and sit and listen to you because I know AI is there helping me with all the quote unquote paperwork, right?
But I mean, Brian, Mark, we all know that, the most valuable conversations happen in the break room, in the hallway. It's the human component, peer to peer. Even as patients or clients are walking by, it's like those interactions are probably more valuable than actually in the chair time.
Oh my gosh, yeah. Our retention rates have doubled now. I mentioned the abysmal less than 1 year retention rate. They've doubled in a year and a half's time. The signs and symptoms of, caregiver stress and burnout and those kind of things have diminished rapidly as we've employed these tools. It's been a major impact on our organization in so many different ways, just from the user subjective standpoint, from the objective clinical and operational KPIs standpoint. I can't say enough about it. I think that giving people time back in their day so that they can engage meaningfully at work and have relationships at work is absolutely critical. It speaks to their well-being, right? We make friends with and become close with people at work. It's just a thing.
I mean, last time I checked, we are in the people business.
That's right. That's right.
So it's like giving people the space to actually engage with people is huge.
And I wouldn't go out on so far of a limb to say this is, AI is a self-care tool. But I will say this, that ethical mandate for provider self-care is a real thing in our business. There's an ethical mandate for us prioritizing caring for ourselves. And unfortunately, because those of us who are drawn into this business, like myself, are codependent caretakers by nature, we have a tendency automatically to deprioritize self-care while I'm busy caring for all of these people. So now, instead of talking out of both sides of my mouth, I can say, hey, we gave you a tool. Are you seeing that it's giving you some time back? And the resounding answer is yes, we want more.
Well, and I want to emphasize the soft boundary that you put out there that said that tool is really probably not the best access point for self-care. And it's like, and there may be a temptation to do so, but I mean, I appreciate the way you stated that. It's,
well, and it's just the matter of giving them some time back so
100%.
that they're not putting their kids to bed and then trying to finish their documentation for the day. I've been a guy who's done that before back in the day. Put my little kid to bed at 7:30. He was so young at the time, and then I'd clock in for my second shift, as I called it back then, where I would go and sit down and try to finish all these notes and everything so that claims could be dropped in a timely fashion and we could get paid for what we do. I started to realize there's a chain of events, right? There's the service delivery, documentation of that service delivery, and then the third link is coding, billing, and collecting, right? The revenue cycle management functions. And the critical middle part of that chain is the documentation piece, and it just had become such a big, heavy burden for people in our space that it was untenable for us.
Yeah, I mean, for those for those of us out there that were fans of The Pit, did you watch The Pit?
I have not, actually.
Okay.
No.
Mark, did you watch The Pit? Oh, then I'm going to make a reference to The Pit, and neither of you guys are going to understand it. But he was like, Santos, finish your charting.
It's that was a mantra for us for years, and still is, but it's just not as big of an issue. And here's the other thing. I'll throw this out there. Managed care has been using powerful AI tools now for the past few years to comb through our charts. They're looking for documentation inconsistencies, inadequacies, insufficiencies in terms of hours provision or what's being documented or demonstrating medical necessity, right? If they find any of those, then they open up an audit. Well, an audit allows them to go back 5 years and look at every member of theirs you've ever served, right? And then that usually results in some money being scooped back into their pile via what we call recoupments. Not trying to slam managed care organizations, but they've been using these powerful AI tools for the past few years. why are we going to this battle, with the squirt gun, and not arming our teammates with, again, the best tools that we can for them to be able to do their job? Suddenly, the quality issues are just not what they were a couple of years ago. The quality is awesome these days.
Yeah. Brian, it sounds like you learned all of this and you implemented it along with a team. And I know you've shouted out to Sunwave a couple times, and they ought to sponsor this episode. but and I know they've got a great team. But do you have a cohort of other leaders out there that are using AI or implementing AI, and that you come together with on a monthly, on a quarterly?
Boy, it's funny you should mention that, Mark. I've thought that would be such a great thing for us to do. The truth is we do not have a regular meeting group. Now, I have via confluence of events with things like NATAP 2026 and the Behavioral Health AI Summit in Nashville here several weeks before that, RX Summit, various other conferences. That's become my go-to place for connecting with people who I view to be thought leaders in the AI and behavioral healthcare space. I've learned so much from them. I love the collaborative effort, and I love staying in touch with them. So I've kind of built this little support group around me de facto, I think, just by meeting these folks. I've also had other folks who work with Sunwave who have reached out and said, hey, I saw a talk you did on AI and behavioral healthcare, and I heard you use Sunwave. Can you share with me how you best deployed AI and used that tool that was in your toolkit to move the needle on your clinical and operational KPIs? And I've done lots of collaborative work with people at other treatment centers too. I think personally that sadly there's enough business for all of us in this space, honestly. So if we find something that works, why would we not share that with our counterpart teammates in other treatment centers? There's enough business for all of us, honestly. So I'm pretty open about sharing everything I've developed. I've shared our AMA blocking handbook with people before. I've shared how we use AI in our system of care. And people likewise in turn are kind enough to share some of the things that have worked for them. And I think that's really how we get better as an industry.
Yeah, we completely agree. This is a time for collaboration, not competition. At least from my perspective. So it sounds to me like from, the takeaway that I think a lot of people should hear from a clinical perspective. Come on in, the water's fine.
Yeah,
and have an approach that's scalable, and then watch the magic happen. That's really kind of what I'm hearing from you. Is that right?
And I hope that I can convey something to listeners out there that there should be an inherent level of trust, because I went into this pretty cautiously, as I mentioned. I just didn't know what to think of AI, honestly, in mid-2024. I understand that there's all kinds of controversy out there, whether it's political or for various other reasons related to AI. I absolutely get that. In the meantime, what I've noticed is there's a correlative link to the care that we're providing to the patients who have entrusted that care to us. Even if it moves the needle and improves the care we provide and the synthesis and the collaborative type effort with community partners by 10%, isn't that enough, right? We owe that to the people who've entrusted their care to us. So that's really where I land at the end of the day on this. It has improved outcomes for us, and that's everything.
The proof is the proof, right?
Yeah, that's absolutely right. So if it improves our service delivery just one iota, I'm all in, right? And certainly not without consideration of other factors, right? But nonetheless, I think it's absolutely been worth it for us.
What's next for Brian Wind?
Yeah, I do clinical consulting work on the side. I love my work with JourneyPure. As I mentioned, I've been with them almost 11 years, and they've been gracious enough always to allow me to do clinical consulting work on the side. I'm involved helping helping out with a very exciting new startup in West Palm Beach, Florida, where I'm spending part of my time these days, called Jade House Recovery. I am helping out the founder and CEO, John Viciano, who's from New York originally but lives in South Florida, to open Jade House, which will be a fantastic, progressive, forward-facing provider of substance use disorder services on an outpatient basis, as well as specialty psychiatric services like transcranial magnetic stimulation and Spravato, esketamine, in addition to comprehensive psychiatric evaluations. We've got a double board certified psychiatrist named Dr. Barnell Phillips, who is boarded in child and adolescent and adult psychiatry, so we'll be able to serve adolescents as young as 15 as well as adults. We'll be in network with Medicaid in Florida, as well as commercial payers, and we've got a nonprofit arm. So really, one of our taglines has become white glove service for the masses. We want to be able to deliver a beautiful service delivery model to the everyday person, honestly, and I'm so excited about it. Launching around August 1st in just a couple of months here, and I couldn't be more excited to be a part of that organization as well.
So you log back in and you do your third shift.
That's right. Now I've got a third. It's just round the clock. Yeah. Well, honestly, I always have prioritized my work with JourneyPure, and we've been through massive kind of iterations as a company. Let's call them up to 35 facilities in 9 different states. We're now back to our original iteration of operating in Tennessee, Kentucky, and Florida with our home base here in Tennessee. And it's been an honor to be a part of my work with JourneyPure. I still love what I get to do with JourneyPure on a day-to-day basis. So really kind of a new reset version of the company that I've enjoyed being a part of there as well. In addition to consulting work, after I leave here, go do some consulting work with a faith-based facility in Woodbury, Tennessee called Spring to Life Recovery. Love working with those guys, and a couple other places as well where I very much do fractional work for them. Again, it's all in the interest of sharing what we know works in this business, right? I really think that we can kind of cross-pollinate in that way and share the tools that are impactful for those we serve. I almost feel duty-bound to do that.
Yeah. Is there anything, Brian, that we didn't ask you that you think might be helpful for the audience as we start to wrap up?
Man, I know that we're getting into a place now, as you and I were talking about, Mark, just prior to starting the podcast today, where there's so many different AI platforms out there now. Shadow AI tools are emerging on the market and those kind of things. Suddenly we're going to get to a place where we've got all these different systems in which data is siloed again. I'm looking forward at some point to the day when we've got one go-to platform that really kind of does it all. Personal assistant, professional assistant, helps with workflow, all of these different things. I'm not a tech guy from a development standpoint, so I don't know how that gets pulled off with appropriate firewalls and things in place to protect data. But I think that's where we'll be headed. And through my work with companies like Jade House, we've adopted really cool forward-facing tech tools like Ray Health. We're partnered up with them.
Yep.
RVK AI to help with managing our call center volume as a rollover prospect. So it's really been cool to get out and develop these partnerships with these third-party companies, and I would encourage people to really explore that and choose wisely. There are some great partners out there that people can choose, whether it's a lab or a pharmacy, or and ask them about their stance on AI, honestly, because AI, I think, will get to a place where it can manage a lot of these different relationships for us.
I mean, shout out to RVK and shout out to Ray Health, who've both been on the podcast. So.
Absolutely.
So, I mean, you chose well, Brian.
Well, thank you, man. It's reaffirming to hear that because, when it comes to third-party relationships, sometimes you don't know.
Well,
right?
we're very choosy, and we try to be on the front end of those conversations too. So that's fantastic.
And we'll drop all your information in the show notes and any resources that maybe you'd want to share as well.
Absolutely.
Just so the audience has more at their disposal.
Of course. If people are interested in seeing the deck that I developed with all the data in it, I'm happy to share that as well, or have conversations with people individually. Honestly, I love meeting people in this business. That's one thing that's probably my favorite thing about this business.
Absolutely.
People I get to meet like you guys.
Brian, thank you so much, man. And thanks for being on the show. We really appreciate it. Appreciate all your insights and everything you're doing for the industry. So thank you. On behalf of Jeff, myself, and the entire MasterMined crew, thank you for jumping in today to listen to this episode. If you would, please rate, review, and subscribe to MasterMined so that we can get this message out to more people. Brian, thanks again for being on the show. We'll drop all your information in the show notes, and we appreciate everything you're doing for the industry. Thank you, and we'll see you next week on MasterMined.
That wraps up this episode of MasterMined. Thank you so much for joining us. And remember, MasterMined is not just a podcast, it's a community. So don't forget to comment, subscribe, and review us. Your feedback helps us continue to bring you content that's relevant and relatable. Thanks again to our sponsor, Snapshot, a digital media marketing agency. And thank you for joining us on MasterMined, your behavioral health playbook.